Welcome to Tech Penguin, your place for clear, useful content daily. Let's begin.
Ivermectin is a powerful antiparasitic medication with specific applications and profound effects on dogs, but its use requires careful veterinary guidance due to potential toxicities. Primarily, ivermectin functions as a broad-spectrum antiparasitic agent, meaning it targets a wide array of internal and external parasites. In canine medicine, its most well-known and widespread use is in very low doses for the prevention of heartworm disease, a serious and potentially fatal condition caused by parasitic worms that live in the heart, lungs, and associated blood vessels of affected animals. These preventative medications are typically given monthly and are highly effective in disrupting the heartworm life cycle. Beyond heartworm prevention, at slightly higher, therapeutic doses prescribed by a veterinarian, ivermectin is also effective in treating various other parasitic infestations. These include certain intestinal worms like roundworms and hookworms, though it's not effective against tapeworms. Furthermore, ivermectin is a common and effective treatment for specific types of mites, such as those responsible for sarcoptic mange, scabies, and demodectic mange, as well as some types of lice. The mechanism by which ivermectin works involves interfering with the nervous system of invertebrates, specifically by binding to glutamate-gated chloride channels found in their nerve and muscle cells. This binding leads to an influx of chloride ions, hyperpolarization of the cell membrane, and ultimately paralysis and death of the parasite. Mammalian nervous systems are generally less susceptible to ivermectin at therapeutic doses because these glutamate-gated chloride channels are not present in mammals, and more importantly, in most dogs, a protective mechanism called the P-glycoprotein pump, encoded by the MDR1 or ABCB1 gene, actively transports ivermectin out of the brain, preventing it from crossing the blood-brain barrier. However, this is where a critical caveat arises: certain dog breeds possess a genetic mutation in the MDR1 gene. Breeds like collies, Australian shepherds, Shetland sheepdogs, Old English sheepdogs, and various crosses of these breeds are known to be particularly susceptible. In these dogs, the P-glycoprotein pump is either dysfunctional or absent, meaning ivermectin can readily cross the blood-brain barrier and accumulate in the central nervous system, leading to severe neurotoxicity. Symptoms of ivermectin toxicity, whether due to an overdose in a non-sensitive dog or any dose in a sensitive dog, can range from mild to life-threatening. These signs typically manifest as neurological disturbances, including lethargy, weakness, disorientation, dilated pupils, blindness, tremors, seizures, excessive drooling, vomiting, loss of appetite, and in severe cases, coma, and even death. The onset of these symptoms can occur within hours or days of exposure. It is absolutely paramount that ivermectin is only ever administered to dogs under the direct supervision and prescription of a licensed veterinarian. Self-medicating a dog with ivermectin, especially using formulations intended for livestock which often contain dangerously high concentrations, is incredibly risky and can easily lead to severe toxicity or death. A veterinarian will assess the dog's breed, weight, health status, and parasitic burden, and determine the appropriate dosage and formulation, or recommend alternative treatments if the dog is a sensitive breed. They can also perform genetic testing for the MDR1 mutation if there's a concern. In summary, when used correctly and under veterinary guidance, ivermectin is a safe and highly effective medication for preventing heartworm and treating various parasitic infections in dogs, but improper use or administration to sensitive breeds can have devastating, even fatal, consequences. Thank you for watching.